One. Okay. Good morning, everybody. Somebody is translating me, or I'm just counting on you will be my translator? No? Or no need to translation. Okay. I remember I lectured once in Korea, and I had a translator, and in the beginning I said one sentence, he said one sentence, and until the end of the lecture I said one sentence, he said yes. So I hope you will understand. Most of my lecture is pictures, so I hope you can understand. I want to thank eBrace company. I want to thank Professor Lin and Professor Cho and all the distinguished guests for inviting me. I will try to focus in my lecture on what I think is important today in aesthetic orthodontics. Lingual orthodontics is part of aesthetic orthodontic concepts that we try today to adopt in order to achieve aesthetics during treatment and after treatment. Many of our patients today have very, very high demands. You can see this beautiful young lady that came to my office. She is a young model. She has a very nice smile, but she doesn't want to show it. The reason is because, as you can see, she has a very constricted arch and enlarged overjet and not very aesthetic smile. And with a proper planning, we can turn this smile to be more attractive and more nice in a very short time. This is the way we did it. If you do it with buccal brackets, Invisalign or lingual, is not so important in this case. What is important is which standards we wanted to align the teeth. Just a small presentation of myself. I graduated in 1993, orthodontics. I'm a dentist from 1984. I already published 4 books. I'm editor of the World Journal of Orthodontics. Now it is called Orthodontics. And my 5th book will be published in around 6 months. I was president of the Israeli Orthodontic Society, and I'm active member of the European Aesthetic Academy of Aesthetic Dentistry. I have 4 kids, young kids, and I have many girls in my office. This is why I'm happy to go to work every day. Our mission in orthodontics, I think, is first to be very creative and very innovative. Second, to have some vision and imagination. And to work in a perfect harmony. My work in lingual seems to me like flying a pilot, a jet. Sorry, this should work. I feel like we are flying a small airplane doing lingual, and then suddenly one of the wings fall. So you become very hysteric, very paranoid, but then you try to remember all the rules that you are working, and slowly you get into control, and without getting into panic, you land safely. So I hope that with eBrace you will learn how to land very safely. Okay. Smile can be very harmonious and very nice, even if the kids have only primary teeth. The harmony with the face is even more important than the alignment of the teeth. If you can look at this beautiful model, that this picture is taken from a brochure of Nobel Biocare. And as orthodontists, what we mostly do is we don't look at the face, the total face. We look mainly on this area. Now, when we look at this area as orthodontists, I can put a list of many problems. Class 2 malocclusion, enlarged overjet. We have tooth number 12, which is a little rotated. Tooth number 22, a little peg shape, and some abrasion and some constriction. And the question is, do we really need to treat all malocclusion? And I think the answer is definitely no. If we have such beautiful harmony, I don't think we need to treat the patient. I don't think we see everything that is imperfect. If you know this young gentleman by the name of Michael Jordan, and very few, especially people who are not dentists, realize that he doesn't have tooth number 12. He has no right lateral incisor, and his midline is completely off. And I think that didn't disturb him to get a lot of money from commercials during the years. Now, when I do my treatment, I have 4 guidelines. One is to try to be as fast as possible. Our patients do not want to have a very long treatment. I want to keep aesthetic during the treatment, not only at the end of treatment. I want to try to answer the main complaint of the patient, and I try to keep the treatment very simple. If it is simple for me and simple for the patient, it's more easy for the patient to do cooperation. Now, sometimes I think that we must think of the patient, about simple and fast, sometimes maybe not to do orthodontics. And I will show you some. Now, I was very happy to be introduced to eBrace. I think that eBrace is, they took incognito and they just made it better. Part of the things that are better in eBrace is the fact that First, it is from stainless steel. And gold is very nice for jewelry, for my wife, but not because it's very, very difficult to do rebonding. And even that the surface of the bracket cover all the teeth, the bracket tend to fall. They fall. Even if you don't want, even if you do a very perfect bonding, they can fall. So you want to do rebonding really easy, and eBrace has mesh, because you can do molding between mesh and stainless steel. You cannot do molding between mesh and gold. This is why, if you look at the protocol of Incognito, you see that there is a special treatment you need to do to the gold in order to rebond. With eBrace, there is no treatment, just clean and rebond. They are more fast. I hope that they will stay fast. And the cost is more acceptable. It's not cheap, but it's more acceptable. Impressions are the same. I prepared a small movie to show you how I bond eBrace in my office. It's 5 minutes. I think you will enjoy it. First, I do dry field. I use these cotton rolls named parotis to open the mouth and to make the field very dry. Etching on all the teeth. Then I put primer on the bracket. On the same time, I clean the teeth, I wash, I dry them again. Then I put some paste on the brackets. You remember I already put primer. Now I put paste. Very, very paste. And then I put a second layer of the primer. Just a little primer, a little paste, a little primer. Then I put the tray back on the teeth. And we use light cure on both sides together. Because if you use it only on one side, then sometimes the other side just lift a little bit. And after I remove it, I do light cure again. It's very important because sometimes the light did not get to some places. So you do light cure again. Now, eBrace send you the bracket with elastic module. This is very good because then you don't have composite on the hooks and on the bracket. So now you take the elastic module out, and I put the wire in, first of all in the tube, in both sides. And then I put modules on each tooth. The whole procedure of one arch, if you work really efficiently, can take around 20 minutes, including the wire. I cut the wire, and after I cut the wire, I use diamond burr . I'm sorry, it's working slowly. I take diamond burr and I cut the wire really exactly with the tube. So the patient will not have poking wire. Okay. eBrace, for me, is quite new. I'm working with eBrace in my office for around 1 year. So I will show you some cases that are in treatment now. That's a case of crowding, open bite. This is how I confirm the case to eBrace. I get setup. I look at the setup, I tell them I want a little more expansion, more torque, less torque, more stripping. I look at the occlusion to see if I will have interference between the bracket and the tooth. I look at the design of the brackets, and if you get a good setup, you can have a very nice alignment. This is after 3 months. You see that here, we don't push the wire too much in. I leave the wire a little out, and I put elastic module. This elastic module push the tooth slowly inside. Okay? This is after 3 months. I don't think that I had this good alignment before with straight wire appliance. Now it's very accurate. I know exactly how the tooth will look, and treatment takes much less time. That's another case. It's a difficult case. She's class 3 case. Crowding. It's very problematic because she has a recession here, so you don't want to push the teeth forward because of the gingiva. So I have to do very careful stripping here. This is right and left. This is hair occlusion. Setup. This is the amount of stripping that we plan together. eBrace cannot decide for you. They can measure, but you must guide them where you want to do the stripping. Sometimes you look at the centrals and they are very triangular. So you can do the stripping there, or you can do the stripping more in the back. It's up to you to decide where you want to do it. We decided to do 0.5 at the premolar and 0.2 in the centrals. Now, you can look from, she started in September 2011, February. She's 1 year in treatment. This was February, this was June, this was September. Slowly we expand the arch. October, November, and January 2012. Midline is still nice. You see that in the beginning there is tendency for bite opening. This is normal in lingual. But if the wires are bended properly, slowly the torque change, and you can see that now the open bite closed. I did not use vertical elastics here. It's only moving from round wire to rectangular wire to get the prescription that I planned in eBrace. Again, you can see how much expansion we got here and where she is now. We got a nice overjet. And this is hair occlusion. You can see slowly we created space here. And now, 2 weeks ago, before I came here, I put a bracket on this lateral. In the beginning, this lateral was blocked completely. And this is in 1 year. I think it is a normal treatment time to do carefully in adult case like this. That's another case. I show this case because I think it is important that you will understand how much control you have with CAD-CAM bracket. Look at this case. She's deep bite, very deep bite. She had previous orthodontic treatment with extraction of first premolar. The orthodontist that did the treatment for her did all the mistakes possible. He closed tooth number 5 and 6 mesially rotated, as you can see here. And the centrals went back palatally and down. So we got very deep bite. You understand? Now, when you do the setup and the planning, you see there is no stripping in the upper because there are spaces. There is a little stripping in the lower. 0.5 in the premolar area is very minimal. It's not a lot. Here is the setup. Now, this is a very important picture. We can design here in the molar area tilting of the bracket in order to overcorrect the position of the tooth. Do you understand? Again, she started, this is an extraction treatment. She already has mesial inclination of the molar. If I will close the small space she has here, it will get even more mesially. I can ask eBrace to make some tilting of the bracket, like tip back. And this is very good for you because you don't need to work a lot. You get already the brackets designed for your needs. So when I look at the case and I look at the position of the bracket, I called eBrace and I asked Jean, my beautiful contact girl, I asked her, please tilt the bracket a little bit. First she asked me why, now she understands. And now look at the case. She's in treatment from April 2011. It's around 6-7 months. Look at the molar here and over here. Slowly, just by putting the wires in the slot, I get upright of the tooth. And I move from round wire to square nickel titanium to TMA to stainless steel. So before I close the spaces, I get even a little overcorrection. Then I can close the space in a really nice way. You see that during treatment, when I corrected the torque of the centrals, there is diastema open. And here the diastema closed. This is at the lateral look. She will remain class 2 molars because this is an extraction, upper extraction case. But the position of the cuspids change and the space open again in order to close it properly. This is in April before she started, and here she is now. You see that the rotation slowly is corrected, space is smaller, and here I use some tricks in order to do the fine-tuning of the case. There is nickel titanium coil spring here to open space, and then I put some power chain to do the rotation of the teeth. This was done again 2 weeks ago. Here was supposed to be music to amuse you. I'm sorry that the audio of the computer is not working. I hope you understand some of my English and some of the message I try to give you in my lingual work. And for anything you need in lingual, you can email me directly. You can look for Rafi Romano in the internet and send me emails. I will very happy to contact with you all, and I will very happy to come again. Thank you very much.